This is a model that highlights the role of trauma and autism together. And you can see, at least by all these different arrows on the screen, that a lot is happening. So what I want to highlight for you are just a few things. One is that autism can impact what is potentially traumatic in the first place, what is perceived to be traumatic. Autism can impact what events are perceived to be harmful or threatening. Autism can impact the risk of developing symptoms as a result of those encounters. Autism impacts how trauma symptoms manifest. And in turn, these experiences may impact the presentation of autism characteristics and overall development. We can't separate one or the other. And doing so gives us an artificial sense that we are doing the proper intervention. If we try to separate them, we are not addressing the full person, and that's a major risk. So unfortunately, even though we really want to be able to say, and people come to me with this question, every day, is it autism or is it trauma? There's just not an answer to that. A lot of times we don't know enough about the early behaviors of a person to be able to recognize, developmental regression or early signs that we might have some autism traits. And if a person is exposed to trauma in utero or right when they're born, we don't know what behavior would have been like without it. So the overlap is really important to pay attention to because it exists and it's I want to say unmovable. There's not an intervention that we can do that's going to say, okay, now we know these are autism behaviors and these are trauma